everyone. Welcome to the show. I'm your host, Dr. Dean Mitchell. Please get ready, get comfortable. You're about to enter the Smartest Doctor in the Room podcast. Holistic medicine is very popular these days, but that wasn't always the case. In fact, I can remember over 10 years ago, if you said you were a holistic practitioner, your fellow medical colleagues would give you funny looks, and even everyday people would maybe ask, what kind of doctor is that? For a long time, I think chiropractors tried to fill the void, covering the holistic medicine, doing their spinal work, but also adding in nutrition and diet. However, over the years, a more rigorous specialty evolved to address holistic medicine. It's the science of naturopathy. And their medical schools offer a naturopathic degree called NDs. And now NDs training is quite different in some ways than conventional medical doctors. But I want to find out. That's when I'm really excited, because my guest today, Dr. Debra Muth, is a very accomplished naturopathic doctor and the founder of Serenity Health Center in Waukesha, Wisconsin, who I hope will help us understand how an ND differs from an MD and why you might choose an ND either in conjunction or instead of your MD. So I'm really pleased to welcome Dr. Debra Muth to the podcast.
Hi, thank you for having me. I'm excited to be here and have this conversation.
Okay. I just started to mention to you before we actually went on that I saw a video on your website where you discuss how you made a pretty big career change after your own illness. Would you mind giving us a little bit of a recap here? Because again, you were a conventionally trained nurse and obviously made some changes in your career.
Yeah, absolutely. I started out practicing as a nurse, quickly went in to become a nurse practitioner. And it wasn't after I suffered some of my own health problems that I realized that traditional medicine as we know it didn't have all the answers for me. I had all my symptoms buried down, and I said, I'm walking into the doc and I'm going to see my primary care, and I'm either going to come out with one of two diagnoses, fibromyalgia or MS. Had the symptoms down, knew what I was coming into. What I wasn't prepared for was walking into the office in August. It was 100 degrees out in Wisconsin. It actually does get that warm here sometimes.
No, I've been there in the summer. Yeah, it does get really warm.
It's
beautiful,
warm.
But it's warm. Yeah.
It's beautiful. I had a fleece jacket on, a long sleeve shirt, and nobody questioned why I was dressed like that when it was 100. I thought it was comfortable. I was just always cold. They came back, took my temp. He's like, something's wrong with this thermometer. Let me come back. Came back 5 different times. And I finally said, what's the problem? He's like, well, your temp is 95. That can't be right. These have to be broken. And I said, 5 of them? Yeah, the doctor will address it. The doctor came in, listened to my symptoms, never addressed the low body temperature, never addressed anything, and said, yeah, you have fibromyalgia. Here's a prescription for narcotics. Here's a prescription for some antidepressants. Go home and get prepared to be disabled in 4 years. And I went, what?
Wow.
I was 28 years old. I had my youngest child.
And this was to another person in the healthcare profession. How scary is that? I mean, again, with your background and your knowledge, you mentioned the everyday person. They would go home and either jump off a roof or go home and just cry all the time. I mean, it's frightening.
It's frightening. And I literally did that. I went to my car. I started crying. I called my husband. I'm like, oh my God, I don't know what's going on. And back then, I will say I had my quote unquote witchcrafty friends is what I called them back then. And they were all the natural people. They were the weeds and herbs and, all of that funky stuff that now we take for granted as being normal. But back then we looked at it as being something really odd. And so I reached out to them and said, okay, somebody has to know somebody that can help me. And luckily, they didn't mind me making fun of them back then. And they did. They took me and taught me about nutrition and taught me about herbs. And lo and behold, as we all know today, I had a thyroid condition that nobody picked up on. Now when
I'm hearing the story, it does sound very classic hypothyroidism. So I was hoping that if you'd come to me, I would have picked that up. I would have, But yeah, that's a really good point. One of the things I just want to say too is so interesting because I've been practicing 30 years and my wife and I probably like really pretty quickly, about 4 or 5 years into our practice, started going incorporating holistic medicine. They called it alternative medicine. There was all these names for it. But like you, it's so interesting. And I tell patients this all the time. My teachers in the beginning were people that had no license. They worked in health food stores, and some of them were incredibly knowledgeable. I mean, about a lot of things that made sense to me. And I kept on remember saying to myself, why isn't there anything in like conventional medicine that's even discussing these things? And, the big limit for those people working in health food stores, who some of them had very good ideas, were that they weren't a healthcare professional. They couldn't order lab tests, and they were working blindly. I mean, on one hand, I commended them. On the other hand, I thought they were doing something, very risky in a sense, because again, you can walk to a health food store and say, I feel fatigued, I don't feel right. And they'll say, do some wheatgrass and this, but you might have an anemia. You might have something else, as you know, from your conventional career. So it kind of leads me to my next question, which really interests me, because I don't know, obviously, a whole lot about this. What is the training like for a naturopathic doctor? I know roughly it's 4 years, but do you do anatomy, physiology, and I'm sure you do other, courses that we never get in regular medical school, like herbology. So maybe just explain to the listener what the training is like.
Yeah, absolutely. So today we have naturopathic schools that are very similar to medical schools. They're 4-year trainings. Some offer a residency, some don't. They study a lot of the same things that traditional medical doctors do: anatomy, physiology, biochem. They study drugs and things like that, but that's more secondary in the training. Our primary is, what do plants do? What do foods do? And how do those plants affect our bodies? And we learn a lot about how many of the traditional medications that we get from the traditional pharmacy these days actually came from plants.
Right.
And we extract out the one piece that we think is the holy grail for that drug, make a drug out of it, and that's how we get it sold. We learn how to use that plant in its whole so that you don't get as many side effects from the medications, because the plants are balanced. And so you get a lot of training like that. We see clients just like, MDs do in school. When you guys come and tag along a residency, we do the same thing in our traditional naturopathic programs too. But really the focus is heavily on that nutrition and those herbs and natural medicines that can bring forth health and wellness. And we also learn all the negative side effects that go with them too. Just because they're plants doesn't necessarily mean they're safe.
That is so important. I was going to get into that, because that is a little bit of the Wild West. And I guess what concerns me sometimes, and I said, I do functional holistic medicine in combination with my immunology. I get concerned when sometimes patients have seen alternative medicine practitioners, and they're on, sometimes 20, 30 supplements.
Yeah.
And, as we all know, there could be interactions. I don't know if anybody's meant to be on that many supplements. And also in naturopathy medicine, do you work in hospitals for a while, or is it all outpatient? Or are there any naturopathic hospitals? Because I'm not aware of any. I know it was in Connecticut, they were trying to work on one, but it never really... No.
In this country, there is not. In other countries, Europe, yes, or even in Mexico, yes. But there are naturopathic doctors that work in some of the, like MD Anderson has some MD/NDs that work there.
Oh, they do.
And there are some rotations where naturopaths can go and train with the traditional medical doctors and see what they do and then bring those things together. But primarily, naturopaths are going to work in an outpatient setting. But during the training process, yes, even here in Wisconsin, we've had naturopaths that have followed doctors at the Medical College of Wisconsin and have done traditional rotations with them during their residency.
Okay, so I want to ask you, maybe we'll go to a couple of specific kind of topics, because I'm curious to learn your approach. As I said, I've seen sometimes patients from naturopathic physicians, in my practice. Now in New York, it's a little tricky because it's not, NDs are not licensed in New York. Correct. So a lot of them instead work in Connecticut or neighboring states, and so that sometimes they end up in my office and I see the workup, which is usually pretty thorough. So I want to ask your thoughts. I'm just curious, one of the things obviously in natural medicine, they really focus on the gut. I mean, that's one of the things I really commend the whole area of holistic medicine, realizing so much comes from the gut, which still a lot of our conventional colleagues are a little bit slow. Everybody's still focusing on their specific domain, whether it's ENT in the sinuses or, rheumatologists on the joints, not focusing on that. Now, one of the things that I see in my practice, and I know a lot of naturopaths deal with, is Candida overgrowth.
Yeah.
So I'm just curious from your perspective, if you saw a patient that their history seemed to be supportive, that they may have Candida overgrowth and being on antibiotics long-term, maybe proton pump inhibitors like the Nexiums. Well, how do you approach that patient? I'm just curious.
So it's interesting you bring that up, because when I started in naturopathic medicine, I joined a practice with 2 MDs, and they were very heavy on Candida as being the issue and all be all for everything. They were very alternative. Today, when I see that, I want to see a test that proves to me they have Candida overgrowth. Because so many times it can present as Candida overgrowth and people can get labeled with that, but that's really not what's happening at all. So I want to do a gut function test, realizing that my gut test is limited. Everyone has a little bit of benefit and downside to them. There's no perfect stool sample test, right? But I want to see if I get a stool sample that has a lot of Candida in there, it's got Candida in there. If it's negative, it's probably not necessarily negative, but then I'm going to go and do blood testing, and I'm going to look at an IgG and an IgM and an IgA. And I want to see if I'm getting anything there. And then I'm going to look at symptoms. And I never want to rely fully on one stool sample. I would prefer, if we can, to get multiples if possible. From there, if somebody really presents as though they have Candida and it's not overgrowing in their gut, it's not in their bloodstream, it's no place else, I'm actually looking to see if this person has systemic mycotoxin illness at that point. Do they have mold? Because their symptoms are going to be very similar.
Yeah, that's a great point. Super. Let me ask you this too. Well, this is interesting because I see a lot of the patients who've seen naturopaths and some other holistic doctors, and they do the stool test. A lot of times it's negative. Sometimes it's positive. As you mentioned, you're 100% correct. Blood testing also kind of variable. One of the things that I do in my test, because my background's also in allergy, I actually do an intradermal skin test.
Yes, I do that too.
Do you?
Yeah.
I find so few doctors do that, and I find it extremely helpful because what I explain to the patients is this, my good understanding, because this test to me actually originated over 40, 50 years ago, because I used to do it when I was in my training at the hospital in New York City in the late 1980s, and it was the height of the AIDS epidemic. And at the time, it's hard to remember all this now, but getting HIV testing, getting something called T-cell testing could take a week or two. And you were admitting a patient to the hospital that you had to make some critical decisions, like how good was their immune system. So we used to do a Candida skin test, also along with either trichophytin and one of the vaccines, like to mumps or measles. And since, again, people had exposure to it, in a normal person, if we put that skin test on them like the day we admitted them, and they usually were in the hospital for a few days, within 48 hours, they would have that delayed 48-hour reaction, almost like with tuberculosis. If they had no reaction, that was not a good sign, meaning that their immune system might be completely depleted. And the way I've used this test, I don't know how you do, but when I do the test now in the office and someone gets an immediate reaction, it's almost like an allergic reaction. It's like this overgrowth. And that helps, to the best of my knowledge, support, hopefully, the really good clinical history. Because again, I'm sure like yourself, when I have a patient that tells me for years they've had GI issues with bloating or constipation, if they tell me they've had chronic urticaria, rashes, obviously women with vaginitis or men or women with rectal itching, these are, or toenail fungus, these are all the things that help support a really good diagnosis, which we know, unfortunately, too, today, even in conventional medicine, sometimes they don't have the time to do an extended history, to pick something
Mhm.
up. And what you started to mention too is interesting that, I've talked about this on other podcasts. A lot of doctors, I don't know why, for some reason, they don't like patients that have a lot of symptoms. It's
No, they
like
don't.
it's like you better just have your limit of symptoms to two things. And I've heard people say something even about with Candida. I want to talk about the
Mhm.
mycotoxins because that's important, but they'll say like nobody can have all these symptoms. Not one thing can explain all that, but it's so silly because like one of the best examples I give to is like, for example, celiac disease. I mean,
Yeah.
when I trained and did pediatrics in a medical school in the 1980s, mid 1980s, celiac disease was like one or two paragraphs in a pediatric textbook. That was it.
Yep.
And just saying that these kids were malnourished, had big bellies, and then you get into the real world, and there's that whole spectrum. And Alessio Fasano, who's at Harvard now, I interviewed him a few years ago, and he wrote a great book called Gluten Freedom, where he basically goes through all the symptoms that a patient with gluten or celiac disease can present. And to me, it's very classical to Candida. But to go back to what you were saying with the mycotoxin, I think that's really important that you brought that up because, again, I sort of a little bit self-discovered this, seeing so many Candida patients, and then the last 7, 8 years, kind of becoming an expert in mold toxicity. I've trained with some really
Mhm.
good people. We've had on Dr. Nathan, Dr. Jill Christer. You're probably aware of
Yeah.
her. She's in Wisconsin, I think, too.
Yeah. She's a dear friend of mine. Yeah.
Oh, is she? Yeah, Jill's
Yeah.
amazing. That you start to see that the mycotoxin illnesses can present very much like Candida, or what I
Mhm.
say also is patients that seem to have Candida overgrowth, extremely sensitive to mold exposure. Would you agree on that?
I would agree on that. I mean, I think they're very sensitive. I think there's some detox pathways that are disrupted in those people who have that chronic Candida. And then that predisposes them to the mycotoxin illness as well. And I use the intradermal testing very similarly to you.
Oh, wow. That's really
And
interesting. Great.
we will actually treat them we'll try to desensitize them to Candida from treatment as well. And I've seen people who they can't. Like I've inherited patients from my mentor who taught me how to do intradermal testing. And some of these people have been on antigens for 30, 40 years. They just cannot get off. And it wasn't until I started learning more about mycotoxin illness that I realized like, yeah, they can't get off of this because they have mycotoxin illness. And then you start to realize they come in, they smell like mold, and you have to try to gently have that conversation. And it's not till you address that the Candida actually clears up then and you get rid of it once and for all.
What do you find? That's the way I can learn. Because again, I use medications a lot of times. I like to use nystatin. I'll use
Yeah.
stronger antifungals when I need to. I do also sublingual immunotherapy to keep
Mhm.
like antigen therapy to keep their immune system strong. But what would be some of your go-to favorite herbs or supplements to help a Candida patient? There's a lot of them out there, as you know. These patients,
Yeah.
they walk in with bottles of things I know. I mean, I'm familiar with caprylic acid and
Mhm.
coconut oil and all that stuff too. But they come in with a
Yeah,
lot of wild stuff. So, what are
they
your
do.
go-tos? What do you
Yeah.
usually like?
One of my first things that I really like to use is Palo Arco.
Mm,
And you can use it as a tea or you could use it as a capsule. It's somewhat gentle. It's not as strong as like olive leaf or garlic
mm.
or oil of oregano. Those are
Okay.
some of my favorites too. But sometimes I find that if people have had Candida for a long time, they're a little too strong for them and they get too much of a die-off reaction. And so
Right.
you really have to support their detox pathways when you start doing that. Because if you start killing off yeast really fast, these people do not like you.
Well,
It's
I have to stop you
miserable.
there too. Yeah, because I want to get your thoughts. Is one of the things that I learned actually like 25 years ago doing this work, because in the beginning, again, being holistic but being conventional, people would come in with chronic severe vaginitis or
Mhm.
clear, fungal dermatitis, and I
Yep.
put them on antifungals. And it wasn't all of them, but maybe 25 or 30% had what you could describe as a die-off or Herxheimer
Mhm.
reaction, which was very unpleasant, and they did not want to come back to me after
Yeah.
that. And I remember talking to some doctors in California, and they had taught me, they said, Dean, if you can do like IV or intramuscular vitamin injections, you kind of really build up their immunity
Mhm.
and they tolerate it better. So I was wondering, like, how do you try to, and that's what I use with
Yeah.
patients while I'm treating them, especially with strong antifungals. So is it,
Mhm.
what, as you were just saying, so what would you do to prep them before putting them on even herbal antifungals?
Yeah, that's a great question. So we try to get their liver moving and their digestive system. So I like to use a product called Tudka Plus to get the bile moving from the gallbladder. And especially for
Mm,
those people who have had their gallbladder removed, I want to make sure they're either using beets or TUDCA to get that bile.
Can you spell
thinning
that
out.
just so I know?
Yeah, it's TUDCA. It's from Cellcore. It's a really nice product. It's somewhat gentle but strong at the same time, and they don't need a lot of it. Usually it's like 1 capsule a day is all we're using for them. So we start that, we get their liver detoxing a little bit with milk thistle, unless they have some ragweed allergies, then we're going to use something more like NAC or ALA to get that gut moving. We usually always bring in glutathione if we can. I'll either use a topical, preferably IV, but I treat a lot of people that are from around the country. So we'll use topicals.
You like that? You like the topical ones? Yeah.
I like the topical ones because I don't want to lose so much in the gut. And these people have such bad gut function anyway.
Right. It dissipates immediately. Yeah. Great points.
Yeah. And you know what? They're tired of taking things. We all get pill fatigue over time. So if there's things that we can use that are topical, then that just helps us out a lot.
That's a great point.
So I'll do that for usually about a week or two. And then I'll start bringing in some of the killing agents. And I do like nystatin as well. I use nystatin too. More so because I love how it works as like Pac-Man in the gut. And it just gets rid of all that yeast overgrowth. And it's milder. People don't tend to have a big die-off reaction. So I will also use nystatin. I do like some combo products. There's a product called Yeast Aid that I really like, and that's got a combination of olive leaf, oil of oregano, pot of orco, a few other things in there. I think it might have some caprylic acid too, but it's something that I can get a lot of different products in at one time. So I will have them start with that. And I usually have them start slow, start with like 1 capsule and then just gradually work up over the course of a week or 2 to 3 to 4 capsules a day if they can tolerate it.
How do you feel? Because I love talking to somebody about this, especially like yourself, because I have so few people to talk about this. How do you feel about the diet? Now, the Candida diet is very restrictive in some ways. I think sometimes too restrictive, because I think originally Dr. Crook, whatever, he was dealing with this new thing, and they didn't really have the knowledge of the botanicals. They didn't have even the antifungals beyond nystatin to deal with it. So I think he put people on these very restrictive diets. That people do very well on the diet, but it's just not really a practical, long thing. So I'm just curious, how do you advise patients about the diet? 'Cause I'm sure you get all the same questions I do, like, how long do I have to be on this? Will I ever be able to have a piece of bread again? Will I ever be able to have a drink again? What do you tell them?
Yes.
What's your
I tell them it's the diet from hell. I'm sorry. And I ask them to do it for 4 weeks. I said, give it 4 weeks. And then let's start to reintroduce things. Good, and I always have people, we're from Wisconsin, right? We used to brew beer and cheese and all that good stuff, right? And I do give them options. Like if you need to drink or you want to drink cleaner things. Do things like Grey Goose or potato vodka, because vodka is pretty clean. Most people tolerate it really well. And then you just have to be careful what you're going to mix it with. Like don't try to do it with orange juice. That's not a great thing. But if you could do like a seltzer water or do something that's a little bit cleaner, I do tell them to try to stay away from the alcohols that are all yeast driven, like beer. Try not to do that.
And wine too.
Yeah, and wine. Yeah, don't do that quite so much. Right. And even some of like your bourbons and whiskeys can be a little stronger in that aspect. Yeah. So I do try to give them some options because it's not fun not having anything. And I do let my patients have some fruit, but I say, let's do lower glycemic index fruits.
Yes, exactly.
Red apples, let's do green apples. Let's do berries. Let's not do bananas or watermelon or cantaloupe, things like that. Try to do some of those better fruits that are low glycemic. And a lot of our clients today too, they're pretty familiar with like a keto diet.
Right. I mean, the paleo and keto are very, it made our life a little bit easier to help these patients. So, do you find that also, just to go back on testing again, also, do you find the GI map helpful? Because I personally don't, but I know a lot of NDs order it, and the only thing on there honestly that ever would tip me off is I think it's calprotectin, which if somebody has God forbid like Crohn's colitis or something like that too. But otherwise I look at it and seeing some of the different was it bacillus or other microbiome, organisms, it doesn't really resonate in anything that change anything I'm going to do. So I was just
We
curious.
use a lot of GI map, and I use it for a couple of different reasons. I want to see where is there good bacteria, like how much do you have, how much is there. I use it primarily to rule out SIBO, honestly. We do a lot of SIBO rule out or rule in with the GI map. There's different bacteria overgrowths that we can see that can prove SIBO is present, and then our treatment would be different.
Well, why wouldn't you do just the SIBO breath test, or you do that as well?
I don't usually do the breath test as much since I started doing the GI map, because since I can see it in the GI map, I feel like I can get more information from doing that than just the breath test. And I want to be able to see where is their digestion. Like, do I need to give you more digestive enzymes? How are you digesting fats? How are you digesting proteins? Those kinds of things. And I want to see your immune system. How bad is your immune system? And I can see if they have a gluten sensitivity, or if I'm dealing with somebody that may really have celiac in the GI map, I can see that as well. So I feel like it gives me a lot of information. Is it perfect? Absolutely not. It's not, but it is definitely a window for us. And I agree with the calprotectin. If that calprotectin is really high, you're off to see the GI specialist. They've got to rule out what else could be going on in there. That could be a problem for sure. And I like to order zonulin too, because it tells me then how leaky the gut is.
Right.
And if I'm dealing with a really leaky gut, then I'm not spending their money on food sensitivity testing. I'm holding that, and I'm just teaching them about rotation and elimination diet up front till we heal that gut a little bit better. And then maybe that's a better time to spend money on food sensitivity testing.
Is the zonulin in the stool or the blood test for zonulin?
It's in the stool.
Really?
It's an add-on to the GI map, but I always do it because I want to see how leaky that gut is.
Interesting. Okay. I know a lot of people always ask about that. You just brought up also a question I wanted to ask you about too. When do you think a patient should choose a naturopath? I know you're a little bit biased, but is it more, would you say, a patient that's dealing with a chronic illness versus, a very straightforward issue? Or do you think it's okay. And do you think like every even young person would benefit from at least one consultation with a naturopath? And, and what about pediatrics and the elderly? I mean, again, you've been in both worlds, which I respect. And I think it's so important. Like, I guess like myself, when you're in two worlds, you can really see from both sides, the good and the bad. So again, if you were, if a friend in another state called you up and said, Dr. Muth, I can't get to you, but I'm battling with a fibromyalgia or maybe an autoimmune disease. I'm seeing my rheumatologist. Do you think I should see a naturopath? And, or what would be your suggestion and why?
Yeah, I think that's a great question, by the way. I think that if you have a functional medicine MD, I think they're going to do very similar things as a naturopath is going to do. So I think either one is a great choice there. I think anybody with a chronic illness or an autoimmune disease needs to see a naturopath, because we're going to look at things very differently. We're going to support your immune system differently. We're going to talk a lot of diet. We all know conventional training, we didn't get much in the way of diet. We didn't get much in the way of toxins in the food. And those conversations have to be had. And medical doctors, unfortunately, just don't have the time to do that and have that conversation. And they usually don't have somebody on staff that's knowledgeable to say, look, you need to be eating organic. You need to be getting this toxin out. We need to be looking at your environment. Let's get all those Febreze things out of your house. We need to talk about toxins. And so I think that's a really great place. I typically, when patients get to me, it's two ways. Either they've seen 20 or 30 doctors and nobody can fix them, nobody can help them, and they just want to throw drugs at them and the patient doesn't want drugs, or they've used drugs and it hasn't helped. Or they're coming to us for truly just anti-aging regenerative stuff. I want to stay as healthy as I can for as long as I can and not take drugs if I don't have to. That's usually where we fall in that camp. And we will definitely say, like, if I have somebody with an uncontrolled blood pressure coming to me, we're probably not the person for you. If your blood pressure is 10 points over, yes, we can make lifestyle changes, dietary changes, get some weight off. We can help you do that to prevent using medications. But if you're coming in with a blood pressure of 200 over 100 and expecting natural medicine to do that, it's not going to work.
Right. I think that's so important. I really respect you saying that, because because I think, some bad things can happen. I'm sure you have, and I've had patients too saying, I will not take medication. I'm like, well, you're heading for a stroke.
Yeah.
Unfortunately, that happened to a patient of mine who came to me. It really wasn't so much she was opposed to medicine. She kept on getting reactions to all the blood pressure medicines. And so she decided not to take it. And she was in her late 40s. She had a stroke, and it's been taking her like 2-3 years to really recover. And, so again, regular medicine, conventional medicine has its place, no question. Obviously, it's commendable when patients want to go more natural and try to do things to help themselves. That makes sense.
Right.
But
and when that person's willing to do the hard work, like when you come to see a naturopath, it is not easy. You're going to change your whole lifestyle. So you have to be committed to doing that. And if you're not willing to do that, don't waste your money with a naturopath, because you're just going to get frustrated. But if you're willing to do the hard work and change, that's a great place to be.
Yeah. Would you be willing to share a little bit like what you would do as your own personal healthy diet and maybe a few supplements or things that you take, just if it was like a model to somebody who came to you and said, what do you do, Dr. Muth?
Yeah, absolutely. So I've done a series called "What's in Dr. Deb's Cabinet" before.
Okay, I gotta find it. Is that online or?
Yeah, it is online. So it's on our YouTube channel.
Okay, I commend all people to go see that. Okay.
Yeah, thank you. So depending on what time of the year it is, I do different things. But certainly, diet wise, I try to do as much organic as I can. Sometimes that gets a little pricey. So I do the Dirty Dozen, like the Clean 13 and the Dirty Dozen is huge. There are certain foods you just don't eat unless they're organic. I try to do.
Be? Just throw out a couple of examples for.
Strawberries would be one. Bananas would be another.
Bananas, even with the covering, that's a problem.
Yes,
interesting.
Because they're grown with so many toxins in them, and then it grows up in the flesh of the banana itself. It's not in the peel; it's in the flesh. I did not know that.
Wow, that's interesting.
Yeah.
Okay.
So you want to try to do as much organic as you possibly can.
Right.
Try to. I tell people, and I do this too, stay out of the middle aisles of the grocery store. Stay on the outside. Do all your whole foods, whole fruits. I like a little bit more of a keto diet, that higher protein, higher healthy fats. I think that's really important for the brain. If I was stuck on an island somewhere and I could only bring, 4 supplements with me, and that's all I'd ever have, NAC, glutathione, vitamin C, vitamin D. Those are my top 4.
Interesting.
I think
it's a great point, because again, too, it does get pricey for people. You sound like myself. I have it in my office, a bunch of supplements. Most of them ones that I take, but again, I'm dealing with patients that have had some more significant illnesses, but I still feel for them the core supplements are like what you basically said. Basically vitamin C, B12. I like zinc. I like the vitamin D3 with K2. And then depending on what their challenge is, if they have what we call like mitochondrial dysfunction in chronic fatigue, then I like CoQ10 or D-ribose, which I learned from Dr. Teitelbaum. So, again, it sounds like you and I are similar in the sense we try to streamline it. We have to be practical. We can't, these people aren't, on a transplant list where they have to take 50 supplements a day to live.
Exactly.
It's just everybody's kind of squeezed these days. So I think those are really good suggestions. So you do eat fish, you eat a little bit of meat, a lot of greens. Is that what I gather is your diet?
Yep. I do fish. I do meats. I do a lot of free range. So I like bison. I do some venison. I do bear meat, things like that. I do. I do grass-fed beef. Try not to do a ton of pork just because it's full of a lot of parasites and things like that. So we don't do a ton of that. But primarily beef, fish, chicken, eggs, those kinds of things.
Do you sneak a pizza and ice cream in over the summer or no?
Oh, absolutely, I do.
Okay, so we had the truth meter going right behind you, and you passed. Okay,
yeah,
I tell the patients too. I like to share like my stories with patients too, and I tell them because they'll say to me like, "How strict do I have to be on this thing?" And especially with the Candida diet. And I said, "Look, try the 80-20 rule. Try to be as good as you can in the beginning." I said, "Look, I've struggled with this myself over the years through my stomach." And I said, and now I'm basically healthier than I've ever been. I said, but I still like to enjoy myself once in a while. So I'll have that slice of pizza once or twice over the summer, and maybe an ice cream a couple of times. And they'll go to me, "That's it?" And I go, it satisfies my, my craving. Because after that, if I ate it every day, I wouldn't feel so great.
Yeah.
And, and I think they get that. So, but
Yeah.
they like to know you're in there with them. It's not
Oh,
like you're
yeah.
standing on the pedestal saying, you got to eat this way. If not, get out of my practice or you will not get
Right.
better. I mean, that's
Yeah, it's
silly.
not reality. And I'm with you. I tell people follow the 80-20 rule. Go have
Uh,
that birthday cake if you're at a party.
right, right.
My vice is dark chocolate. I eat dark chocolate every single day. Do I
Uh-huh.
eat a lot of it? No, but I'm doing that 80% dark chocolate, which is,
Mm-hmm.
it's pretty bitter. So you don't need a ton of it. You have a little square of it, and it's enough to give you that benefit. And I
Yeah.
have to say, I was super sad when I saw the article come out last summer about chocolate having heavy metals in it. And I went, oh my God.
Well,
And
there's nothing. I tell people, my line is that we have to pay extra to not be poisoned. It's
that's
like
right.
that's the whole thing with the organic, and I guess it really goes back to what our grandmothers told us. Everything in a little bit of moderation,
That's right.
and
Yeah.
we do the best we can.
My thought when I saw that article and I said to my friend, I'll just put on more glutathione.
See, that's thinking smart. That's one step ahead.
Yeah.
Unfortunately, I didn't get a chance to read the book, but I saw it was on your website about the dark side of injury because I thought that
Yeah.
was interesting. And maybe you can
Mhm.
talk about that a little bit because you mentioned it was a family member hurt their back and went through this torturous process of trying to get medical help and
Yeah.
compensated financially. What key things could you tell us about that? Because again,
Yeah.
I'm sure also too you see people that go on disability for either mold
do.
toxins or other health issues, and it's horrible. First, you lose your health, you lose your job, you start to lose your money, and that's probably the time you would wish you were a millionaire or a billionaire because that's really when you need the money to hold in and hopefully turn
Yeah.
things around. But instead, what happens is things go from bad to
To
worse.
worse.
Yeah.
Does. It really does. It is so heart-wrenching to see people have to go through our system like this. And the biggest advice that I can tell you is second opinion, third opinion, fourth opinion. Like you don't give up. Keep seeking out people that can give you answers. And it gets really hard and you get labeled a lot of things by doing that. But I wish I would have done that. I hold all the guilt in this, and my husband is the victim in it. And he tells me not to feel guilty, but I do still feel guilty because as the healthcare practitioner, I guided him to a surgeon that came very highly recommended that many of my clients had seen and had great success with over the years. But I didn't know what I didn't know, right? And my husband underwent a double fusion. At the time, he was experimenting with new technology that we weren't aware of. He didn't know what he was doing with the procedure. The rep was in the room with him. And unfortunately, it wasn't until later we found out that he had an addiction problem at the same time. And my husband was left with permanent nerve damage as a result of the surgery. And he's better today, but still not great and still can't work. So I hold a lot of guilt in that. I brought him to the table, right? But you have to get past that somehow.
Yeah, but I mean, obviously, you were trying to help him. I
Right.
think again, I didn't get a chance to read your book yet, but I think the biggest concern I always have with patients that come in that position is that do they have support? Do they have an
Yeah.
advocate? I mean, look, we all being in the profession, hopefully try to get to the best person possible. We can't know all the answers. We're also human. I just got a text right before we went on from one of my assistants. A patient called, mast cell activation, something related to hormones. Can they, guarantee I will help them? And I said, I can't. I said, I'm not Midas Muffler. I can't give any guarantees.
There's no guarantees in this world.
Right. We do the best we can. We look at the risks and the benefits, and we don't want to see anybody suffer.
Yeah.
And, we try to make the best decision possible that we have at the time. And, again, the only thing I can say, like in that, in those kind of cases, that too bad there's really not like a company or something where you have physician, nurses, advocates for patients to advise them, steer them in the best again, the no guarantees again, but the best possible way, because it's overwhelming for people.
Yeah, it really is. It's extremely overwhelming. And I see this so much, as I'm sure you do too. Our chronically ill people don't have a great support system typically because they've been sick for so long. Their friends have kind of gone on with their life, moved on. They don't want to hear them complain anymore. And they can't engage in creating a relationship that's dual-sided. So they lose their friendships. Then their family starts to abandon them. They've lost their job. They've lost their work family. And now they feel like they're by themselves on an island and they've got nobody. And you and I become their somebody. And it's a hard place to fit in, but you need a support system.
Yeah. One of the things too I'm grateful for, we can mention, but now obviously with the patient's name, that you and I were working on a case together. And, I think that's also one of the things that gets missed in medicine so much. Like, as I said, I was so glad when the patient was telling me about you and said that you would be welcome to hear from me. And we were able to, get in contact about her case, because I always felt, and I was fortunate in my own practice because I had my wife also, like, two heads are always better than one.
Yes.
And believe it or not, a lot gets accomplished when two doctors even mull over a case together. I used to always tease my patients. I would say sometimes tease them if they saw my wife and myself. I said, "You're lucky you got two Mitchells thinking about your problem." And I think that's unfortunately doesn't happen enough in medicine. It happens sometimes in hospitals and training programs, but they're young then, and it's they don't have the experience. And unfortunately today, so many healthcare providers are so busy that it's hard to connect. But when we do, it's definitely for the patient's benefit.
Yeah, you bet. I mean, and I have found so many practitioners in our world to be so helpful. Like, they want to share, they want to educate, they want to help each other. There's not a lot of territory because unfortunately there's just too many sick people to go around. There's more than what we've got practitioners for. And so everybody is willing to help and teach, and you just have to reach out and recognize that, sometimes it's busy. It takes a little while to connect, but when you connect, it can be really powerful. And then you make a great friendship. And now you have another go-to person when you're stuck to be able to pick up the phone and say, "Hey, what are you thinking?
What do you think about this?" Right. Exactly. 100%. Yeah. It's really actually also one of the reasons I did this podcast. I'm so lucky. I'm doing it now 4.5 years, and we're getting close to 150 providers that we've interviewed. And it's just incredibly expanded my network of getting that maybe sometimes quick answer. What do you think about this? Or would you try that? It's really incredible. And again, it's all about, that's what this podcast is about, is the listener getting the best medical advice possible, to make those key healthcare decisions. So, Dr. Muth, as we're kind of wrapping up, is there anything else you want to share with us, or where patients can find out more about your practice and your work?
Yeah, absolutely. Thank you. So if you're looking for me, you can find me at serenityhealthcarecenter.com. We also have a YouTube channel. We have a Facebook page. And I would just I want to encourage patients to don't give up. Like, if you think you've seen the last person and they've told you there's nothing anybody can do for you, don't give up, because medicine is changing so rapidly. There are new things we're learning every single day. I've been in this industry 25 years, and every day I wake up and say, how did I not know this? How did I miss this? And it's not that you don't know or you miss, it's just that it's changing so quickly.
Correct.
And we are learning so much every day. And even though there wasn't something 6 months or a year ago to help you, there could be something today. So just keep reaching out to people, keep talking to people, keep sharing. Somebody will find an answer that will help you. Will it make you better 100%? Absolutely not. We're not 100% on our best day. But if you could even get 30 to 50% improvement in how you're feeling today, that would be amazing. It could be life-changing for people. So don't give up. Keep fighting, keep looking, keep working with people. I think that's so important today.
I think that's great advice, and I can see why your patients really adore you. So anyway, thank you for taking the time to come on today, and we'll be in touch, I'm sure, in the future.
Thank you so much for having me. This was a great conversation.
My pleasure. Debra, we're probably going to hopefully release it next Tuesday. I'll shoot you an email.
Okay.
And good luck with everything.
Thank you, and I'm happy to share it.
Okay, thanks.
All right, thanks.
Take care. Bye.
Bye-bye.